Hello, I'm Chini from MSK Marai.
Today, I will discuss the appearance of the ACL on sagittal MRI and bony landmarks, including the lateral intercondylar ridge and lateral bifurcate ridge. Let's discuss the appearance of the ACL on sagittal MRI. The femoral attachment of the ACL occurs on the medial aspect of the posterolateral femoral condyle. On sagittal MR images obtained with the knee extended, the ACL fibers are taut and run parallel or within 9 degrees of the roof of the intercondylar notch, Blumensatt line. The anteromedial bundle fibers originate from the anterior and proximal aspect of the femoral insertion, while the posterolateral bundle fibers originate from the posterolateral aspect. On MRI, the anteromedial bundle may appear darker and thicker than the posterolateral bundle, which shows higher signal intensity. When the knee is flexed to approximately 90 degrees, the yellow line is the lateral intercondylar ridge, an elevated bony landmark on the lateral wall of the intercondylar notch that forms the anterior border of the ACL femoral footprint. This ridge has an average length of 18.0 mm and spans from the femoral articular cartilage margin to the roof of the intercondylar notch. Next, the green-marked area represents the lateral bifurcate ridge, relatively perpendicular to the lateral intercondylar ridge. It stretches from the lateral intercondylar ridge towards the posterior articular cartilage margin, with an average length of 11.6 mm. The lateral bifurcate ridge separates the anteromedial and posterolateral bundles at their femoral attachments. It runs superior to inferior when the knee is at approximately 90 degrees of flexion, which, according to anatomical terminology, corresponds with an anterior to posterior course when the knee is extended. Thank you for watching this video. If you found it helpful, please hit the like button.